The only way to find yourself is to lose yourself in the service of others. This is a quote by Mahatma Gandhi, one of my heroes, and it's a quote that stuck with me from the first time I heard it in high school to my very first day as a medical doctor in a public hospital in South Africa. I arrived at work, stethoscope in one hand, excitement in the other, ready to start on this new chapter of my life, this chapter of saving lives, so you will. But you see, what I found is that I was a very small part of a much larger system, a system that was buckling under the weight of the immense population it was serving. A system where resources were far and few, and what little resources we had was being very poorly allocated. I was part of a system that some had said had collapsed. And we as medical professionals felt frustrated on a day-by-day basis because we felt more akin to firefighters putting out fires that were ignited yesterday and that the system would reignite the following day. Because we were not getting to the source of the problems. And so, what I realized was what we need to be thinking about in our healthcare system was far deeper than that. All around me, my medical professionals that I worked with, my friends, were depressed, burnt out, being awake for 40 hours straight overnight and expected to still function optimally. And sadly, some were driven to suicide, overcome by the guilt of the immense population and the responsibilities that they burdened themselves with. But these medical professionals could not think about anything else they could do with their lives. It's all they could do. And so they came to work every single day because they sacrificed so much of their own life so that their patients could live theirs. But it also got me thinking as to how did we get here? How did we get to a point where healthcare, a fundamental human right, a backbone of a country, reaches such a state of poor inefficiency? And the first thing you might think is, oh, well, it's easy, let's just hire more doctors, right? I mean, that should take care of the problem. But you see, the problem is we have a constrained budget in South Africa, and as a result, there's a limit to the number of jobs we can actually employ doctors within the public sector. And so we have a phenomenon where more and more doctors are driven to the private sector, the other side of healthcare. But a lot of them move to the private sector citing very humane reasons, wanting better quality of life, wanting better work-life balance, wanting more time with their families, wanting access to resources that could actually help their patients. Now, after spending a few years in the public sector, I myself had a brief stint in the private sector, and my first impression was, wow, what an incredible system. All of a sudden, there were no waiting times, patients were receiving their procedures on time, I was having access to resources I'd only read about in medical textbooks. Everything just seemed to work. But you see, the system came at a cost, a very, very expensive cost. Because you see, South Africa's private system works on a predominantly a fee-for-service model. And what that basically means is it's like a restaurant, but the only difference being in a restaurant, you know exactly the price of the things you're ordering. And in a hospital, a lot of the time you get your bill at the end of your hospital stay, at which point your eyes pop out. And that's why so many South Africans eventually resort to medical insurance companies to help aid their pay. I never dreamed about a situation where I would have to sit on the phone with a medical aid representative and try and convince them that my patient was sick enough to warrant an admission. But sadly, that's the reality today. Medical aids can no longer keep up with the costs. And if we are talking about things I never dreamed about doing, I never dreamed about a situation where, having learned that my patient's medical aid funds were depleted, I would have to now be the one to go and break the news to this patient that in order to continue care, they would have to cough up hundreds and thousands. It's not something I trained for in medical school, and quite frankly, something I just did not want to carry on doing. And I was quite vocal about the fact, and I complained a lot. But all I received as a response was, well, what do you expect? You're in the business of health. I'm sorry, what? the business of health, I could not think of two more opposing dimensions, because I understand profit being an incentive for efficiency in a system. But I couldn't get on board with the fact that healthcare, a fundamental human right, be used as another money-making corporation. I couldn't get on board with the fact that a patient at their most sick, at their most vulnerable, be put in a situation where they now had to find funding for their care. And so that's eventually why I moved on from there, and together with my brother, we formed MyJeeni Health as an initiative basically to look at more creative solutions to the healthcare problems we face in our country. And digging a little deeper, we found out that according to the WHO, almost 70% of our doctors eventually work in the private sector. But what's even more ironic is that the private sector serves less than 20% of our population. And so you have a situation where 70% of our doctors are serving less than a fifth of our population. And so it almost makes sense, in a sense that our government eventually moved to an initiative of the universal healthcare system, the national health insurance, something that I'm sure is on everybody's minds, because it should be. You see, the national health insurance has been successfully rolled out in a number of countries, including African ones. And as I touched on, perhaps in an attempt to reconcile these disparities, it might be the way to go. But there are things to bear in mind when we are rolling out these systems that the government has implemented. For one, many countries with the national health insurance still have long waiting times. And whenever you have a situation where there's only one source of funding, a lot of the time, only the bare minimum of the resources are provided, and services are pushed to only the bare minimum, with innovation pushed to the side. And as I'll outline later, innovation is key moving forward. And given our slight history with state-owned enterprises, you can understand our skepticism. But we're going to hope, because, well, South Africans, we're really good at that, right? Hope. But I ask you, is hope enough? Is there something that we could do on an individual level so that we could make sure that the system actually functions as best as possible? Is there something we could do to take healthcare into our own hands so that government initiatives such as the National Health Insurance could be proven as effective as we can? And that's what I want to also focus on today, because moving forward, of course, we can do things about it. And I want to focus on two general principles moving forward. One being understanding the idea of what healthcare really is. And two, embracing the idea of creativity in healthcare. So on the first thing on what healthcare is, let me start by asking you, how many of you have been to a doctor when you are sick? Raise your hands. Almost everyone. All right. How many of you have been to a doctor when you're completely healthy? Like one or two. Why is that? Why have we built this culture where it's acceptable that the only access we have to a medical professional is when things have gone wrong, when we are sick? Take a typical GP, for example. I mean, they decide to start a private practice. They hire some equipment, for example. And then what do? They sit and wait for people to get sick, and then they offer their services. Is that really a healthcare system? You see, what we've really created at the end of the day is not a healthcare system. It is a sick care system. It is a system that is passive, a system that is reactive, a system that waits until things go wrong, until it steps in to help. We've become so good at providing hyper-specialized treatments with super specialists, but we've become so poor at preventing very basic preventable diseases. So we've become so good at being efficient, but very poor at being effective. You know, we often joke as medical professionals that patients Google their symptoms and come to us with the worst case scenarios in their head. But I ask you, what if we as medical professionals given them as a credible alternative? Have medical professionals gone out into the world to actually engage in the communities to see what's going on? Why is it that the first thing I think about when I purchase a car is, does it have a maintenance plan or not? But I have no maintenance plan for my body, for my mind. Why is it that the only time I think about going to the psychologist is when I'm depressed or suicidal? Who's taking care of my mental health the rest of the time? And so in the same way we have financial advisors who guide our financial decision-making, perhaps it's time we start having health advisors, where medical professionals engage and go into the communities so that they can arm the people with medical information they so desperately need right now. And I say desperately need because we've reached a situation where diseases of lifestyle, diseases like diabetes, high blood pressure, cholesterol, cancer, depression, anxiety, have reached an all-time high. And more importantly, they're comprising most of the mortality worldwide. So if not now, then when? We often joke about, or not quite joke, but we're quite shocked about looking back at generations ago, 200 years ago, where people had grueling procedures done, procedures like partial amputations without anesthesia, because anesthesia didn't exist at the time. But we still look back at that time and we think, my word, that was barbaric. But I almost guarantee you, 200 years from now, people are going to be looking back at our time and thinking, could you believe they waited until people got sick before they stepped in to help? It's absolutely ridiculous. And so the first thing we need to understand is that healthcare needs to move away from sick care to actual healthcare at the forefront. Prevention is no longer a luxury, it is a priority. It needs to be the backbone of all our healthcare system decision making. But that's the first principle. The second principle is the idea of creativity. And that's creativity in funding and also embracing innovation. I touched upon the fee-for-service model. And what it has indirectly bred is a culture where more and more patients are being squeezed in order to maximize profit. But in countries that have been known to provide world-class healthcare, countries such as the United States, for example, they've become really good at providing that healthcare, but it's also totally unaffordable at this stage. And so they've reached a stage where they're forced to look at alternative models of funding healthcare. Are we going to wait till we reach a stage of total unaffordability before we decide to do things a little different? And there has already been substantial evidence of alternative funding models owing to the fact that studies are now being done all over the world on alternative models. And one such model that's become quite popular is the rise of subscription healthcare. In the same way you pay a flat fees to a DSTV or a Netflix account, what if you could pay a flat fee to a healthcare professional and have unlimited access to their insight? What if you could see a healthcare professional on a regular basis? The only reason all of you said you don't see a medical professional when you're healthy is, well, why do I need to pay more? And I almost guarantee you, if we moved to a different kind of subscription-based model, perhaps those exact people would be calling that doctor every single day, trying to get as much info as they can, because medical knowledge is something that everybody is hungry for. But that's on funding. What about the idea of actually embracing innovation? The healthcare system is notorious for being painstakingly slow to innovation. And given that it is a highly regulated system that is rigid and hierarchy-driven, it's understandably so. I mean, there are lives at stake, so you need to have some rules in place. But that's no excuse to have almost no innovation at all. And in our South African context, where resources are so depleted, it's time to bring in these alternative, creative ways of looking at things and working with regulatory bodies so that we could work towards this common goal. All around us, we have a rise in the digital revolution. At our fingertips, we have apps, cell phones, wearable technology. These have all changed the face of healthcare from being something that is somewhere in some building, something that was episodic, to something that is now coming to me and you, something that is continuous and, most importantly, personalized. But how can we start bringing those kind of technologies to underprivileged communities, to people who can't even afford those things, because they still get the same diseases we do? And so embracing this idea of creativity is key in moving forward, because we can't be doing things the same way we've been doing things for all these years. Because as Einstein said, insanity is doing the same thing over and over again and expecting different results. And so focusing on prevention as the backbone and embracing creativity is, I think, key to moving forward. And I'd like to end off by sharing a quick story. One of the most rewarding years of my medical career thus far was working in a rural hospital in South Africa. But unfortunately, on one of those nights, I was alone in the emergency department of that hospital, and a lady in her mid-40s came to us. Unfortunately, when she came to us, she was on the brink of death. You see, she was suffering from severe complications of advanced cervical cancer, diabetes, and high blood pressure, all three of which, in today's South African context, are completely preventable. And sadly, despite our best efforts, she did not make it into the night. But what was even more devastating was the fact that she had left behind an 11-year-old daughter and a 14-year-old daughter, both of whom were now orphaned because their father was just not in the picture. And all I could feel at that time was how we failed her as a system. Perhaps there's a small chance that had she had more regular access to healthcare professionals who were engaged in the community, had she had more access to services, maybe she could have prevented the very diseases that took her life, that left her children orphaned. I'm somebody who's within the system, and therefore maybe based on my own experiences, my own insights, my own skills, there's a limit to how much I can see and I can do. But healthcare is something that's a common problem to us all. And for you on the outside looking into our system, maybe you have your own insights, your own skills, your own connections. And perhaps it's time we finally started working together on this one problem that unites us all. In South Africa, we pride ourselves in this unity and diversity. But it's this diversity we need so desperately right now. The one thing we all have in common is that we are alive today, at this very moment. Our health is our ticket to that. Our health is our ticket to living the best life we possibly can live. Maybe it's time we start treating it that way. Maybe it's time we start treating it for the utmost priority that it is, as an individual and as a country. And so maybe, as a standing nation, it's time for us to join hands so that we can finally start making healthcare more affordable, more accessible, more creative, with prevention at the forefront. And maybe if we dream just a little bigger, we could finally reach a stage where we could prevent people from ever becoming patients. Thank you for your time.